This conference will now be recorded.
Welcome to all of you from the platform of Succeed MRCOG on joining our session. And I am Dr. Saima Gafar. How are you doing, all of you? And how's your preparation going? I hope the pace is no faster as we are approaching the exam. And today we will be discussing two important stations from maternal medicine module. So let's begin without wasting time. Who wants to present first case? Okay. Christina wants to present the case. Okay, Christina.
Yes, doctor.
Please open your mic. Okay. Please open your mic. Okay.
My camera?
Okay. Are you ready?
I am ready, yes.
So I am
My
going to set your
my
2 minutes
voice is
time.
clear, doctor?
Okay. And you will get 2 minutes to read the station, and then you will get 10 minutes to perform the station.
Yes. So 2 minutes you will give me?
Yes. Your time has started.
Ma'am, it's so small, ma'am.
Is it visible now?
Ma'am.
Okay. Your 2 minutes have completed. Now I'm setting your
Okay.
10 minutes. Please start.
Just say to start. Okay. Hi, I am Dr. Christine, one of the doctor in the antenatal clinic. Can I confirm your name and age, please?
Yes, doctor. I'm Amanda John, 22 years old.
How would you like me to call you?
You can call me Amanda.
Okay. How are you doing, Amanda?
I'm fine, doctor.
Amanda, as I understand from your notes, that you are pregnant 8 week and it is your first baby, and you already diagnosed with Albert syndrome, and you are here to discuss about the pregnancy plan. Is that correct?
Yes, doctor.
Any other concern today?
Yes, doctor, I'm worried about my pregnancy as well as my baby.
Yeah, I understand your concern, and in a moment I will discuss with you about all your concern. But before coming to your concern, I wanted to ask you some question. It will give me a clue about your condition, and we will answer all the concern, and we will put management plan. And I will give you patient information leaflet. How it seem for you?
Yes, doctor.
Okay, so can you tell me more about your pregnancy? How it's going?
Doctor, so far, yes, my pregnancy is okay till now, and I'm taking folic acid. There's no problem.
It is blend or unplanned
Yes,
pregnancy.
doctor. Doctor, it is
Congratulations.
unplanned pregnancy. It is unplanned pregnancy, but I want to continue it.
Okay, congratulations about your pregnancy. And can you tell me you did the booking blood visit or not?
No, doctor.
Okay, and you started folic acid.
Yes, doctor.
You know the dose of the folic acid.
Yes, 400 microgram.
Okay, and it is your first baby.
Yes, doctor.
Okay. I wanted to ask you about your condition. You have already Albert syndrome, and as I read, it is from 14 years. So are now become expert about this condition. Can you tell me how you diagnose and how it started?
Yes, doctor, I was diagnosed when I was 14 years of age. And at that time, I developed blood in my urine. And the doctor told me that my kidney is not functioning properly. Till that, I'm under regular follow-up with kidney doctor. And my condition is under control.
And when was your last visit with the kidney doctor?
About 3 months back.
He aware about your pregnancy?
No, doctor.
He give you any advice about the pregnancy if it is okay or any contraindication?
No, doctor, because I was not planning for pregnancy. I did not
Okay,
discuss with my doctor.
I understand. And what about the last blood test and scan for the kidney?
Yes, it was done 3 months back, and my kidney tests were normal at that time.
I see. And are you on any medication?
Yes, I'm taking enalapril.
Enalapril. Okay. And any other medication?
No, doctor.
Okay. And can you tell me that you have any other medical condition?
No, doctor.
Any surgery before?
No, doctor.
And your period was regular?
Uh, yes, doctor.
Okay. And are you smoking or alcohol drinking?
No, doctor.
I am sorry to ask you, are you on any recreational drug?
No, doctor.
Any blood transfusion before?
No, doctor.
You aware about your height weight ratio?
Yes, it is 20.
Okay, perfect. And are you aware of RH type of your blood group type?
Yes, it is positive. Be positive.
Okay. And you have any reservation for blood transfusion?
No, doctor.
Okay. So, Mrs. Amanda, I wanted to tell you that about this condition. As you already know about this condition, I wanted to tell you that this condition is most women who is follow with the MD team, it is a specialized group of doctor, includes the obstetrician and the baby doctor, the anesthesia doctor, the kidney doctor, and the specialized nurse and specialized midwife. If they follow the plan and the treatment, and their condition is stable and well controlled, many women will give good healthy baby and good pregnancy and delivery. Although some women unstable and it can affect their maternal condition and also affect the baby condition. According to the maternal condition, the pregnancy can affect the Albert syndrome by causing deterioration and worsening in the kidney function, and sometimes it can lead to acute kidney failure and chronic kidney failure, oliguria. And coming to the maternal condition, it may lead to development of pregnancy-induced hypertension during pregnancy, and blood pressure problem in pregnancy, and also may increase the risk of formation of blood clot in the lung and in the leg. And for the baby, it can affect the growth of the baby, and it can lead to delivery of the baby early, and maybe need to admission in the neonatal care. So your case will be under a group of doctor, the MDT, and it will be on consultant lead unit. And also we will give you the routine antenatal care. We will do the booking blood test, and we will give you the folic acid. We will make assessment of the VTE score. You will need to receive the blood thinning agent from 28 week and until 6 week after delivery. And also we will offer you now folic acid. You will need to do the scan for the gestational to determine the age of the baby, and also you will do the anomaly scan at 20 week, and you will need extra scan for determination for detection of the growth of the baby in case of there is any small for gestational age, and it will be started from 20 to 24 week, and you will have extra visit with the consultant lead unit. Coming to the delivery, it will be after consultation at 36 week. We will discuss the mode of delivery according to the condition of the baby and the condition of you and the kidney function. It will delivery can be vaginal delivery unless there is any obstetric cause, so we can do cesarean section. The delivery will be in the hospital and under care of the MDT team, the specialized group of doctors. The anesthesia doctor, the sleep doctor will come and assist you to check the most suitable pain relief for you, and the kidney doctor will come to see if the fluid monitoring for you and the fluid, the amount of fluid you can receive, and we will make continuous monitoring for you and your baby, and one-to-one support. At any time you have any problem, we can make expedite delivery by the instrumental delivery, and if there is any obstetric condition, we can go to emergency cesarean section. Also after delivery, you are risk of bleeding, so we will give you active third stage of labor. We will advise you to breastfeed baby, and we will give you after that referral to the contraceptive clinic, so you can receive the long acting contraception that's suitable for your kidney function and your condition. I will refer you now to the consultant, and I will refer you to the kidney doctor. And about the enalapril, we need to take advice from the kidney doctor about the need to continue or stop it. As enalapril, it is ACE inhibitor, so it is not baby friendly, and we advise to stop it and change it to another medication after the kidney doctor confirms this. So please don't stop from your side. And this is the information leaflet you can read, and I will refer you, I will make appointment with my consultant as soon as possible. Are you having any concern?
Okay, so Christine, your time has already finished. I have already given you 1 minute extra.
I don't aware about this,
Okay.
the time not in front of me. Okay. Okay, doctor, I'm waiting
Okay.
for your feedback. Thank you, doctor.
Okay. Okay. Thank you. Thank you. Okay. So, coming to your feedback, Christine, are you appearing in the upcoming exam?
May, doctor, May.
Hello. Okay, no. So, what I gather that your applied clinical knowledge is very good, and you tried to cover most of the points. But what I noticed that you are speaking and speaking from after information gathering. You did not give me any chance to speak, and you are telling everything without asking me, am I clear? Without checking my understanding, without involving me, and you did not give the information in chunks. It is very important. It is very important with communication point of view. Okay, Christine.
Yes, doctor.
Okay. So your introduction was good, and then you developed a rapport, and you confirmed the aim of consultation, and you set an agenda. You asked about the concern of patient, and then your history was very good. You asked about you took history of pregnancy as well as you took history about Alport syndrome, and you tried to cover you tried to cover most important points in the information gathering. Your information gathering took a lot of time because you included some irrelevant things in the information gathering because
Like what?
maternal medicine because the maternal medicine template are very large and it becomes very difficult to complete our task on time. That's why we have to always take very crisp history and information gathering. So you asked about her condition. You did not ask about what is her phenotype because most of the these patients are already knowing either it is X-linked condition or autosomal dominant or autosomal recessive condition because it can affect her pregnancy, her chance of her baby to have this condition. Okay. Then you asked about blood transfusion, any reservations of blood transfusion. These things can be omitted to make your history short. And then you asked about smoking, alcohol, drinking in just one line. It is always better to ask in uh, step by step. How you will ask, may I know, do you smoke? Any drinking? Any recreational drugs? So always try to ask step by step. Otherwise, patient will get confused after hearing your question. Am I clear, Christian?
Yes, doctor, but can you tell me, you said I can omit the blood transfusion, the blood group, the blood reservation. Any other thing I can omit? The
No, no, blood group.
contraception I can
Blood
omit?
group is important. That yes, contraception because it was unplanned pregnancy. So it means you should ask about her contraception, whether she was using any contraception. Then patient, when if you had asked this, the patient will reply that I was using condom. Then you will say that Amanda, condom is very good method of contraception, and it also prevents sexually shared infections, but it is not very effective because sometimes it may burst and it can lead to unplanned pregnancy. So at the end of this pregnancy, we will advise you some very effective methods of contraception. Okay, am I clear? So whenever
Yes.
you uh, uh, in the history there is unplanned pregnancy, always ask about contraception. Okay, and always ask about the patient whether you are happy to continue this or not, because sometimes in unplanned pregnancy patient may not be willing to continue the pregnancy. Okay.
Okay.
Then, what important information you missed in the history was family history because Alport syndrome, it is a genetic condition, and many of her family members may be affected. So in this case, her brother was affected with a similar condition, and it was very important point which you missed in the history.
Okay.
And you forgot to ask about allergies.
Yes.
Okay. So these important information you can ask. Then you did not ask whether his partner is tested for similar condition or not, because her risk of the risk of her baby developing the similar condition depends on either her partner is also having similar condition or not. And then uh, in the management part, it was important to address the concern that her baby can have the similar condition. Okay, Christian?
Yes. Yes, doctor, I miss this.
Oh, yes, because this is most of the time this condition is X-linked condition, and it is similar to the hemophilia, in which the male baby are affected more, and if it is a female baby, the female babies are affected less. The severity of condition is more in male babies. So some women choose to end the pregnancy, and that's why they want to know the sex of the baby. And in that case, we can offer her cell-free DNA to know the sex of the baby. And if the sex of the baby is male, they can be offered chorionic villus sampling to confirm whether the baby is having this Alport syndrome or not. Because when this condition is in the male, most of these men develop end stage renal disease before the age of 40, and this condition is very severe. Okay, am I clear?
Yes.
Okay. Then you mentioned about all the risk, maternal fetal risks, most of the things you mentioned, but you are using medical jargon, like you used oliguria, you used pregnancy induced hypertension. Instead, try to use lay language, and this is also important in the communication with the patient. Okay.
Yes, doctor. So
Okay.
for the oliguria, I can say what little urine
Are
or
you
what?
passing enough urine? Yes. Are you passing enough urine? Are you passing any blood in the urine? Then you can ask, do you have any problem in hearing, any problem in vision? Because this condition also affects eyes as well as ears, and it also tells the severity of her disease, because when the eyes and ears are involved, it means her condition is more severe. Okay, am I clear?
Okay. Yes.
And the prognosis of her pregnancy will depend on either her condition is stable, or she has moderate or severe chronic kidney disease. In case she already has moderate chronic kidney disease, then her chances of deterioration in the pregnancy are quite high. Okay. Okay.
It is
So
if moderate
important
high.
mention, uh, I said that if her kidney function is already deteriorated, then they will become more worse during the pregnancy. On the other
Yeah.
hand, if her kidney is functioning normally, then her chances of healthy pregnancy are more. Okay, am I clear?
Yes, doctor.
Okay. Then important safety point you missed was aspirin, because she is very high risk of developing preeclampsia. And aspirin, we can advise her with a dose of 75 to 150 milligram. And you multidisciplinary team you involved, good. And intrapartum care, postpartum care was okay. And there was risk of clot formation, and you did the risk assessment for VTE, and you offer her low molecular weight heparin in case her risk is more. Otherwise, if the risk is not very high, the general advice we will offer, which will be to increase her hydration, and increase mobilization and stockings. These things can be provided to all the patients. And postpartum, the risk is very high, so most of the patients are offered low molecular weight heparin at least postpartum. It will be according to her risk scoring.
Doctor, sorry, Albert
Okay.
syndrome not considered at the score 3?
Chronic kidney disease is stage 3, And so it depends, because this patient said that her kidney function were normal before pregnancy, and this enalapril is given not for the blood pressure, it is given to prevent further kidney loss. It is given as routine to prevent deterioration in the renal function. Okay,
So it
then you advised her to change this enalapril to another medicine, right? Okay. So in the communication of colleagues, you will also involve a genetist.
yes.
Addressing the concern of patient is important, because when you ask my what is your concern, then I said I'm just worried about my baby, because I was worried that my baby may be having similar condition, because my brother is also having same condition. I don't want my baby to have similar condition. So you will offer a referral to the genetist to discuss the risk of her baby having the similar condition, right? And then fetal medicine unit will be involved in case we offer her CVS or amniocentesis. So these are important points which you missed. Okay, so let's come to the key. Can you see my slides? All the points which I discussed are here.
Yes, doctor.
Okay, okay. Swelling, you can ask about swelling in your eyes or legs, just to know about the uh, uh, status of her disease, because if she has swelling around eyes or edema, it means that she's developing proteinuria in excessive amount, and her kidney is not functioning properly. Because we don't have her test, we will also offer her to check her record. Okay, so am I audible?
Yes, doctor,
Yes,
clear.
ma'am.
Okay. And then this was the history which I told you. Whenever you complete your history, always thanks the patient for sharing the information, and then ask her, do you want to add something? Because patient may want to share something which you have already missed, and in this way you will not miss any relevant information. Okay. When you start explaining the management, always start from the reassuring words. And so, how you will say, I have just written my lines. You can follow them. Do you have an idea how the disease affects the pregnancy and how pregnancy can affect your condition? It is most common inherited kidney disease that affects the uh, spotting tissue of kidney, type 4 collision, and there are three types, and it is due to faulty gene that we can inherit from either parents. Usually, the severity is less in women, and any loss in renal function is reversed post delivery. Many women are able to have healthy pregnancy and healthy outcome, but I am afraid to tell you that in some women, there can be very rapid loss of kidney function in pregnancy. Therefore, close follow up in pregnancy is very important. Even with the normal renal function test, many women can behave very poorly in pregnancy, and sometimes there is need of dialysis, and sometimes we have to terminate the pregnancy also. So this information we should be open and honest with the patient that follow up is very important. So you told about all the risks, how the disease can affect the pregnancy. I think you included all them. Miscarriage you missed. Management, a multidisciplinary team. This was important safety point. Consultant, genetist, senior nurse, senior midwife, anesthetist, physician, as well as fetal maternal unit, and then consultant-led unit, and genetic testing, and the routine care which we follow in all the patients. Routine template, ultrasound, and then booking blood, 20-week NMD scan, Gauss scan, aspirin, folic acid, VTE assessment, and then anesthetic review, a delivery plan. Your applied clinical knowledge is very good, Kristen. Okay, but this communication of point of view, with communication point of view, you always try to give information in small chunks, and in between ask the patient understanding, and always address the concern of patient. These are important points related to communication and patient safety. Okay, Christine, am I clear?
Yes, doctor, I recognize that I forget the genetic testing, and it is important because she was worried about her baby.
Yes, right. So, vaginal delivery, continuous electronic fetal monitoring, one-to-one care, and this third stage of labor management, avoid ergometrin, and postpartum care. The baby will be tested for the similar condition. In the contraception, combined hormone contraception is contraindicated, and NODS registry. It is a national organization for rare disorders. All patients with rare disorders are registered there, and this organization is also support the patient as well as it helps in the research purpose. Okay, and whenever you complete your maternal medicine template, always complete the circuit by advising her that before next pregnancy, you should receive proper preconceptional care and folic acid. This line you can use in every maternal medicine template. Then write back to GP and arrange another meeting with consultant and offer her patient information leaflet, support groups, all these covered. And these are the similar points which I discussed. These are domain wise. So there are important information which I want to tell. This condition affects the type 4 collision, which is present in the basement membrane of kidney. And in 65% of the patients, this condition is X-linked, whereas in 15% it is autosomal dominant or autosomal recessive. This end-stage renal disease is diagnosed in 12% women under 40 years and in 30% women aged 60 years. So there is progressive renal loss. Whereas in men, the renal loss develops very rapidly, and 90% of the male develop end-stage renal disease at less than 40 years, requiring dialysis and renal transplant. This is the reason that if her baby is male, we can offer her we can offer her CVS. Okay, and then 95% of the women develop hematuria and 75% develop proteinuria. If the proteinuria is nephrotic range, low molecular weight heparin as well as diuretics are also used. Another option with such couples is PGD with IVF before next pregnancy if they want to avoid that their baby have the similar condition. AC inhibitor is recommended once patient develop proteinuria even before to slow down the progression of end-stage renal disease and prolong the life expectancy. So this AC inhibitor is given in routine to these patients. It is not for the control of blood pressure. It is to prevent her progression of her disease. So these are important points, clinical point of view. So anyone has any question? Is it clear to everyone?
Yes, doctor.
Ma'am, any fluid restriction during labor, ma'am?
Okay. Yes, fluid restriction is important because her kidney is not working properly, so it is very important. And syntocinon, we will also give it carefully because it also causes fluid collection. So everything should be managed very carefully, and MDT should be involved intrapartum also, and there should be hospital delivery. Okay, okay. So no question. Everyone is clear.
Is
Okay,
that
so now
recalled?
we will move to our. Yes, this Alport syndrome is very commonly asked in the exam. Okay, and important thing in maternal medicine module is that you follow a template and apply in every case. And even if you don't know about the station more, much, you can handle most of the things, because if you perform good in communication with the patient and information gathering, you may miss some points if you are not at clinical knowledge. But even if you follow all the template, you can score good marks in this maternal medicine module. Okay, so next session will be presented my co-mentor Dr. Sima Gani. Sima, are you here?
Yes, I'm here. So make me presenter so I can
Okay.
share my slide.
Okay, you can share your screen.
So all of you can see my slide?
Yes, ma'am.
Okay.
Sima, please
So
put
now,
large. Yes.
yeah, it's large already. Okay, so as we have discussed a very important case in the first half of our session, so this is also very important case. And you know, maternal medicine and antenatal care module, they always come intermingling with each other in the exam. So it can come as a, preconceptional counseling station, and these condition can come with a booking state. Okay, so it's very important that how you proceed, how you have a practice to take a Krebs history, and how you proceed in your station. So, so anyone volunteer to do this station?
Ma'am, shall I, ma'am?
Yeah. Who are you?
Monica, Monica, ma'am.
Manikam, you want to do?
Huh.
Okay.
Yes, ma'am.
So I'm setting your 2 minutes time.
Hmm.
Okay, just wait. Now, can you see the slide?
Yes, ma'am.
Okay.
Ma'am, next page, ma'am. Previous one, ma'am. Hmm.
Okay, your time is up.
Ah,
Now you
hello.
start.
Hello. I am Dr. Monicam, doctor in the antenatal clinic. May I check your name and age, please?
Yeah, I'm Lisa James and I'm 25.
How you want to be called?
You can call me Lisa.
Uh, Lisa, I'm really sorry. My consultant is away for an emergency. Because of that, the clinic is also running 30 minutes. You have been made to wait 30 minutes. I apologize to you. Shall I continue the consultation on behalf of my consultant?
Well, doctor, I'm really upset because I'm
Hmm.
waiting since long time, and
Hmm.
now you are saying that your consultant is not here. What kind of
Hmm.
services you are providing to your patient?
She's
I'm not
attending.
happy.
Hmm. Please continue.
Yeah, I'm not happy with the services. You
Hmm.
starting your clinic very late. Your consultant is not here. What kind of services
Hmm.
is this?
Because of the emergency, my consultant is away. Otherwise, it would not have become late. I'm sorry, this will not happen again. We'll make a, will I will I mean, inform the management so that they will make some alternate arrangements. Uh, we'll look at it. Sorry for the
Oh,
same. Hmm.
okay.
Lisa, please tell me. You have I from your GP's letter, I gathered that you're coming with the pregnancy at 8 weeks of duration with the condition called Graves' disease. Am I right?
Yes.
Hmm. And this is your first pregnancy. Do you have any other concerns to discuss? And what is the expectation out of this consultation today?
Yeah, doctor. Actually, I'm diagnosed this with this condition 6 months back, and now I'm getting pregnant. So I'm just worried about the
Hmm.
effect of this condition
Hmm.
on my pregnancy. Whether it is safe to continue the pregnancy, or what should I do?
Lisa, your concerns are valid. Before that, shall I ask you a few questions to know more about you so that we'll be able to come to a safe management plan? Uh, Please tell me about your condition in your own words, Lisa.
Mm. Yeah, doctor, I was all right 6 months back. Then I started of not feeling well. I'm irritated and I'm having a very palpitation, and most of the time my hands get moist. So I went to the
Oh,
GP, and after having all the investigation, it
mm,
came out
mm,
that I'm having this condition.
oh, I'm sorry to hear. Are you taking the medications regularly?
Yeah, I'm taking
Mm.
medication.
Uh,
Yes.
when did you visit your consultant recently?
Yeah, I think just before my pregnancy, 2 months
Mm.
back.
Are your thyroid tests are normal?
Yeah, at that time it was normal.
Okay. Uh, Please continue the medication with a good control of this condition with the medications. Usually, women have good outcome, so you need not worry
Hmm.
about this. We have a good team of experts, including your consultant also. Uh, so you'll be
Hmm.
very cared very much. Do not worry. Do you have any palpitation or tremors of the hands now?
No, I'm feeling okay at the moment.
Mm. Have you taken folic acid?
Yes, I'm taking.
Okay, this is planned pregnancy, no?
Yeah, actually, me and my partner looking forward to have a baby, and before that, we were using condoms, but since last couple of months, we are trying for a pregnancy, and hopefully,
Uh, okay.
I conceived spontaneously.
Mm. Congratulations. So, um, are you having any nausea and vomiting?
No,
Hmm. Do you have any pain in your tummy?
no,
Any discharge?
no.
Okay. Please confirm me your age, Lisa.
Yeah, I'm 25 years old.
Okay. Have you done cervical screening?
Yeah,
Hmm.
I have got one test, and it's normal.
Okay. Do you have any other medical condition for which you're treated by a GP?
No,
Okay. Uh, are you taking any other medications?
no,
Any allergies?
no,
Any family history of similar condition?
no.
Okay. Do you smoke?
No, not really.
Any alcohol?
Occasionally.
Eh, Uh, Alcohol intake is not good for the baby, and so it is advised to avoid this in pregnancy. If possible, you try to reduce it. And if you want to quit, the helpline is available. If you when you have the feeling of quitting, please inform us. We'll help you. Do you have the habit of taking recreational drugs?
No.
What is your weight height ratio?
Yeah, it's normal 24.
Uh, do you have good support in the family?
Yes.
Uh, uh, Do you have any feeling of down, depressed for the past few weeks?
No.
Okay. Are you aware of your blood group?
Yeah, O positive.
Okay. What medication you are taking for the
Yeah, I'm
thyroid problem?
taking. Yeah, I'm taking this PTU.
Okay. Do you want to add anything, Lisa?
No, that's all.
Okay. Thank you for the information you have provided. Lisa, I want to examine you in presence of chaplain with your consent. The blood pressure, heart rate, temperature will be recorded by specialist nurse. Have you undergone
Mm-hmm.
any scan or blood test so far?
Not no, not now.
Okay, okay. So this is a high risk pregnancy, Lisa. So you'll be under the care of a group of experts, including my consultant, specialist nurse, specialist midwife, the thyroid doctor, the psychological counselors, support groups, and the physician, the pain doctor, and the radiologist. I mean the imaging doctor and the fetal medicine specialist also, and the
Mm-hmm.
dietitian and the physiotherapist. And with good control of this condition, you can have a good outcome of pregnancy. And do you know about this condition? What do you know about this condition?
Yeah, little bit, not much.
Okay. It is a increased functioning or increased working of the thyroid. So the gland is producing more of thyroid hormone. So we are giving the propyl thiouracil you are taking. No, that is safe in the first 3 months of pregnancy. You can continue that, and you
Mm-hmm.
please continue the folic acid also. And
Mm-hmm.
you will be offered the dating scan, and down screening also will be offered to you. Then
Mm-hmm.
you'll be offered the booking blood tests, including the full blood count, grouping, and RH typing, antibody, urine culture test also. Then you'll be offered this aspirin also will be given to you from 12 weeks till 75 to 50, 150 milligram till the daily till the delivery. It will be offered to you to prevent you developing increased blood pressure in the during pregnancy. And the risk for
Mm-hmm.
clot formation will be assessed, and if required you'll be offered blood thinners also. And do you have am I clear so far, Lisa?
Yes.
So you'll be having frequent visits, and each visit blood pressure and urine protein will be tested. There are some risks to the mother, as I told you, risk of increased blood pressure and urine protein, a condition called preeclampsia and its complications. Some women may
Mm-hmm.
have increased risk of miscarriage if uncontrolled. This condition will be leading to miscarriage, early labor, risk of early birth, sorry, early labor, and some may develop any bleeding in pregnancy also. Some may develop uncontrolled uh, working of the thyroid, leading to a condition called thyroid storm with the high heartbeat and increased temperature with the fits like that. They may recur. Rarely this can occur, requiring admission in the hospital and treatment in intensive care unit. And there's a risk of a cesarean section is also there. And the baby can have this sometimes this condition can happen. These medications also can act on the baby, giving rise to some birth defects. And baby can grow small, and rarely baby can develop decreased thyroid function or a swelling of the thyroid also. And rarely the baby can mm, die in womb also because of decreased growth of the baby. Baby may require admission in the special care baby unit also. So you'll be followed up carefully, and you'll have a scan at 18 to 20 weeks to uh, head to toe of the baby will be tested. And if any defect in the baby's heart, if the heart rate is high, the baby will be tested and you will have a special scan in the fetal medicine unit. Am I clear so far?
Okay, so what would be my mode of delivery?
Uh, and your mode of delivery will be according to the condition of the baby. That is, we call it as obstetric indication. That is, any after birth lying in the lower down position, you may be offered cesarean section. But if the growth is very small and the blood flow is very much reduced, or if it develops any condition of increased high blood pressure, that may require early delivery. which may be because according to the growth, sometimes before 32 weeks also, you may require cesarean section after giving injection steroid to improve the lung maturity of the baby. And from 26 weeks, you'll be offered a growth scan also. And your delivery will be in the consultant-led unit under care of a consultant and specialist midwife. One-to-one care, continuous support will be given. At about one thing I have to tell you, at 24 weeks, you'll be having a test called a thyroid receptor antibody test. If it is positive, the baby will be monitored by the growth scans to see for any this heart block in the baby also, mm, any increased
Okay.
heartbeat. Okay, then you'll be treated in the labor ward. Progress of the
Time is up,
labor will be
Manvi.
assessed. Okay, yes, ma'am.
Yeah.
Thank you, ma'am. Hmm. I have.
Okay.
I should have
Thank you.
noted the time, ma'am. Sorry, ma'am. So the
No, I
you'll be.
actually the bell
Hmm.
has already rang. I'm going to give you a chance to come to close your
I,
station.
sorry, ma'am. I
But you
didn't
keep
notice
on,
at all.
but you keep on
Hmm.
continuing. Okay.
I was.
So,
Yes, ma'am.
yeah, you
Ma'am,
perform
during
very
second
well.
half, I have to
Yeah.
improve. I mean the speed, ma'am. Ma'am, in the second half,
Yeah.
you have to give the carbamazepine, ma'am. That I want to tell. And in the during delivery, the active management of third stage of labor, and the
Mm-hmm.
grouping and saving, the continuous electronic fetal monitoring, and the baby will be cared by the baby doctor, and he'll be looking for any thyroid function and also of the baby, and with the risk assessment for clot formation in the postoperative period. Breastfeeding will be encouraged. All this I wanted to tell you,
Yeah.
ma'am. And the thyroxine,
So,
dosage of the medication will be altered, antithyroid drugs by the specialist also, ma'am.
mm-hmm.
And I wanted to
Okay,
give
so
patient
well, Manika,
information
you
leaflet.
perform
Uh,
well.
mm,
You perform well, and you have
mm,
enough knowledge, particularly of this
mm,
topic. But it's
mm.
very important how you deliver and how you accommodate all the important points within this 10 minutes which have
Okay,
given to
ma'am.
you. Okay,
I
so
will
that's very
reduce, ma'am.
important thing. Try to make your sentences very short, concise.
Mm, mm.
Don't give long sentences. Don't
Okay,
give your
okay.
information in a very long sentences.
Mm,
Okay. So
mm,
first of all,
mm.
before giving the feedback, I just want to hear from you. How do you reflect on your performance?
Yes, ma'am. I was not able to tell everything. That is, I should have reduced. I mean, the information gathering also. I should have finished as early as possible. And I
Mhm.
didn't know whether I have reduced your anger,
Yeah, your
and that
starting
was.
is yeah, your starting was really nice.
Mm,
I'm happy that you pick up the main thing, which
mm,
is very important in terms of communication with the patient. That you acknowledge this thing that consultant is away and the clinic is also running late. So in this kind
mm,
of situation, how to handle this situation, how to handle your role player. So you were up to the mark in at this point of time. Okay. So
okay.
you apologize for the consultant and you also apologize for the clinic. And again, when the road guard said you how what kind of services you are giving to a patient,
Mm,
I'm not happy. So you just
mm,
raise that we will discuss our management. Usually it is not happening, but to avoid
mm,
anything in the future, so we will definitely
mm,
look into the matter. So this is a very
mm,
good thing. This is the main thing. That's why these things are written in the scenario that how you
mm,
handle this situation. Okay,
mm.
so your communication went at this point in the first 2 to 3 months, 3 minutes. It was a clear impression by the examiner that you are a passing candidate.
Okay.
Okay, so next
Mm,
thing is that you have already seen that this is a 8 weeks pregnancy, first pregnancy. Patient is having this condition, and I'm glad that you haven't said that you have a disease because most of the candidate use that you are having this disease. So always use the word you have this condition. Okay,
condition. Yes,
so I'm
ma'am.
glad that
Mm,
you use the word condition. Okay, 6 months back and kindly review her. So this is a
mm,
case which is referred by the by the GP. So your introduction, your formation of rapport with the patient, and how you break the ice, how you confirm the purpose of the meeting, and then you
mm,
address the concerns of the patient. And then at the same time, I'm glad that you reassured the patient, okay, don't
mm,
worry, we
mm,
all are here to help you, and we have
mm,
a team of a specialist doctor. So we
mm,
try to help you out in having a good outcome of your pregnancy. So that's also a
mm,
good thing. And then you make agenda that I would like to ask you a question. Then you start your information gathering and you inquire about the that how this condition is being diagnosed, and currently the patient is having any symptoms of Graves' disease like
mm,
tachycardia, palpitation, any tremors, any problem.
mm,
And then
mm,
you inquire about the detail of the pregnancy, how is this pregnancy is
mm,
going. And once the patient said that I'm looking forward to have a pregnancy and glad that I became pregnant spontaneously, so you congratulate. So this is also a good thing. Also, you inquire about that have you done all the booking tests or not. So
mm,
so your initially starting of the station was very nice. Okay, then you
mm.
inquire about the folic acid as well.
Yes, ma'am. The plan should have been. I should have been
Hmm,
fast, no, ma'am. Ma'am,
in the
should I
yeah,
do the examination, ma'am, at 8 weeks also?
examination on the
The examination of the patient, ma'am,
as this is a virtual, you booked for the virtual exam or you booked for the face-to-face exam?
face to face, ma'am.
In the face-to-face, so you can offer that
Okay.
my
Mm.
I will ask my nurse to check your blood pressure. So this is the
Okay,
thing.
ma'am.
But in case of virtual exams, there's no need to say anything particularly
Mm.
related to the examination,
Mm. Okay.
because it is not a, realistic kind of thing to say that I'm going to do examination,
Mm.
because they also know and we also know that it is not possible. Okay, so
Mm.
the thing is that once you move on for the management case, so management, you try to explain all the things in a very in a bit detail. So don't give
Mm.
detail, just be quick and crisp that what are the complication related to the mother, what are the complication related to the
Baby.
fetus, and how we can overcome. There's a team of specialist doctor. Then
Mm.
you will have frequent visits, and every visit your blood pressure would be monitored, your protein
Mm.
sample, your urine sample would be taken to see whether
Mm.
there's any protein or not. So that's
Mm.
how you can say. And there is a risk that that the woman like first start with the reassuring thing that most of the women with this condition, and if it is well controlled, so they have a good pregnancy outcome. uh, but
Mm.
uh, in this condition, the mother may have increased risk of development of the high blood pressure, along
Mm.
with the leakage of protein in the urine. There may be
Mm.
a risk of miscarriage. There may be a risk of worsening of the condition,
Mm.
in which we call as thyroid storm, and this is a very critical condition and may require hospitalization in a specialized care unit. So that's how you can say. And similarly for the baby, there's a risk that baby may miscarry, baby may grow smaller, and
Small.
baby
Mm.
may deliver with a
Mm.
low birth weight and may deliver earlier than
Mm.
her due date. So this is all
Mm.
the thing. And sometimes in the worst situation, may die inside the womb. I'm so sorry to tell you, I don't mean
Mm.
to scare you, but these are the important information that
Oh.
you need to be aware of. So that's how you can
Mm.
say. And sometimes these hormones can also affect the baby thyroid gland as well. Okay,
Mm. Yes, ma'am.
so so that's how you can see in a very crisp line. Don't need
Mm.
to give detailed information.
Mm.
Okay? So
Thank you, ma'am.
now,
Thank you.
yeah, no, I'm also given. And you also tell about the aspirin. This is
Mm.
good, but aspirin, because in the strategy as well as all the information leaflets, aspirin is not mentioned in terms of Graves' disease. But as
Mm.
Graves' disease is a autoimmune condition, so all autoimmune condition we can give aspirin to reduce the
Mm.
risk of preeclampsia. Okay, but
Okay.
at the
Mm.
same time we can say to the woman, because there's a controversy.
mm,
we can say that usually we give, because this condition has a risk of development of high blood pressure with the leakage of the protein, and in order to prevent this, we offer low dose of aspirin throughout the pregnancy, which start from the
mm,
12 weeks. But
mm.
we need to discuss, we need to consult with the consultant and the specialist doctor, because sometimes this aspirin may increases the level of the thyroid hormone and may worsen the condition, because this
Oh,
has
okay.
happened.
Mm.
So you can say, so this so that's how you can balance the
Okay.
point of
Whether it
aspirin
is
or not.
indicated or not. Okay. To be
So we can
decided by the
discuss
thyroid.
with the
Mm, mm,
consultant. Yeah. So usually
mm,
we give, but in this condition, there's a risk that aspirin may
mm,
increases the risk of thyroid hormone. So
mm,
we can give you after consultation with your specialist doctor as well as my consultant.
mm,
So the examiner who's sitting in front of you, so they realize that you know what are the
mm,
safety of this
mm.
medication given or not. Okay.
Okay.
So now domain-wise station, Manikam, the history presenting illness and pregnancy detail was very good, up to the mark. You
Mm,
inquire about the current control and effect of and how the this condition is affect her quality of life. Any recent test results. You highlight the medications. And then you inquire about, may I know more about your pregnancy, the planned, unplanned, folic acid. You offer the screening test and all the booking investigation. Then you inquire about the medical and surgical history, obstetric. This is a primary gravida. Okay. You inquire about the smear test, and you also inquire the family history, because it can run in the family. You inquire about the allergy, then BMI, blood group. You inquire blood group. Blood group you inquire. Okay.
but
And you care about the smoking, alcohol, and the support at home, and also inquire the mental health. So your information gathering is a past domain. Then communication with the colleague, your introduction, your checking of the identity of the patient, then your apologization for the consultant and the start of the clinic late. So you address this situation very well. Then you create a very good rapport with the patient. You ask the concerns of the patient and set the agenda. Then uh, you meanwhile you also inquire about how much the patient know about her condition. Then you start giving all the information clear organized way, but to some extent you just start giving a detailed information in a very
mm,
long sentences. So
okay.
always give a very crisp information. What are the,
Mm,
just make your mind, okay, this is a condition, what this
mm,
condition is all about, what are the implication of this condition on the pregnancy, and how the pregnancy affect this condition, and what is the maternal effect, and what are the fetal effect, and
mm,
how can we plan her management, including the antenatal care, intrapartum care, and the
mm.
postpartum care.
Okay.
Okay, so
Mm.
be very concise and
Quick.
crisp,
Mm,
because
mm.
we have only 10 minutes. So in 10 minutes
Yes,
we
ma'am.
cannot give
Mm,
all the detailed information.
mm.
Okay, so what are the
Yes, ma'am.
important points that should not be missed?
Mm.
Okay, then
Uh,
information leaflet, check the understanding in between, because it all comes in the communication with the patient. Colleague,
mm,
in terms of communication with the colleague, you involve all the specialty in your
mm,
multidisciplinary team.
mm.
Why this is important to involve physiotherapist?
Yes, ma'am. It's not
Hmm?
necessary, ma'am. It is not
Not
necessary.
necessary. So
Uh,
basically, your
Dietitian
time
also
when,
not necessary, ma'am. Uh, as a
because
routine, it's coming through my mouth. I'll control it.
you make your set agenda that multidisciplinary team in this
Mm,
domain, these all
mm,
specialty comes. So at in
mm,
every station you just spoke up. No, this is not the thing. Multi
okay.
in this station, particularly your consultant, your specialist
Mm,
doctor of this condition,
mm,
let's say imaging doctor, because we need to see the growth of the baby. Okay, and the
mm,
baby doctor. Okay, so
mm.
these are important thing. And
Okay.
if the
Okay.
patient wants any labor analgesia, so we can say that the pain doctor can also be
Mm, mm,
involved. Okay,
mm,
otherwise no need for other specialty. So
mm.
don't because it also will waste your time, and you
Yes, ma'am.
were not able to complete your station in your time,
Station. Mm,
and it
mm,
also give a negative impact on the examiner. Okay,
mm,
so patient and the patient information leaflet, and to try to you use, most of the time you use lay language. So good.
mm,
Then patient safety, again involve the patient in the process. Then
Mm.
the safety of the PTU, you rightly say that okay, PTU is safe to be used in the first half of the pregnancy. Then you say me that it has to be changed after 12 weeks to a carbimazole.
Yes, ma'am.
You told now? Okay.
Yes, ma'am.
So why
The second half of the pregnancy, I wanted to use
hmm,
carbamazepine. I
carbimazole?
told
Okay,
only at the
because
end, ma'am.
uh,
Only at the end I
because
told, ma'am.
because PTU is not considered to be safe for the liver of the
Uh,
mother and the baby.
hepato,
Okay,
hepatotox.
then
Yes, ma'am.
then at the same time, okay, you offer the booking visit investigations, but at the same time, you
Mm.
also tell about the side effect of the of both the drug, because
Mm.
both drug can cross the placenta and affect
Mm.
the baby's thyroid gland, as well as these drugs can also reduces the white cells of the patient. And so if
Mm.
any case, if you want, if you develop any sort of infection in terms of fever, sore throat, cough, so you have to immediately
Ah,
report to your hospital. So this
yes,
is the
ma'am. I have
main thing.
forgotten. Mm. Mm.
Agranulocytosis, this is the main thing. So try
Ah.
to jot down
Mm.
the main points that should not be missed
Yes,
anyway.
ma'am. Mm.
Okay, so PTO
Mm.
and carbimazole side effect is very important. You
Mm.
emphasize on the compliance with a regular follow-up apart from the routine visit, and be open and honest about all the implication of the condition. And
Mm.
whenever Manikam, you are seeing any bad kind of thing like death of the baby inside the womb, so always say that with a very gentle voice that I'm so sorry,
Mm.
but these are the important information you need to be aware of. I didn't mean to scare you.
Very
Okay,
okay. Mm.
then provide information leaflet, support group, contact
Mm.
number. Okay, all the thing comes in the
Mm.
patient safety domain.
Mm.
Okay, so
Yes, ma'am.
applied care knowledge. Graves disease, information about the Graves disease, and then effect on the mother. Okay, third, I'm glad that you covered this thyroid storm point, um,
Mm.
and early labor and preeclampsia, hypertension, miscarriage, feeder growth, low birth weight, thyroid hormone derangement, you spoke about it. Then like this, that antenatal care management, intrapartum care, and the postpartum care. So antenatal
Mm.
care, you will be treated by a group of specialist doctor or team of specialist doctor that include this. You need to
Mm.
continue folic acid. You need to continue your medications. I'm offering you
Mm. Mm.
this booking test, and then
Mm.
you will need to be regular with your antenatal visits. And at around
Mm.
20 weeks, we will give you this anomaly scan, which is a scan to see how the baby is going. And
Mm.
then we also check. You rightly said that at every visit, your blood pressure and your urine sample to check for protein will also be checked.
Mm.
Then continuation of the medication and the growth scan. Intrapartum, our aim, you linger on this line,
Mm.
and the care of the intrapartum period, you linger on the statement. You just say
Mm.
that when the road
Mm.
guide told you that what would be my mode of delivery, so you can say that our aim,
Okay. Mm.
usually in this condition, with well controlled condition, the woman usually, the aim of the
Mm.
woman to deliver vaginally in a constraint led
Mm.
unit. But until and
Okay.
unless if there's
Mm.
any problem arising in terms of
Mm.
a fetal growth related problem or heart rate problem or any
Mm.
worsening of your condition, so in that case we will discuss with the consultant, and you may require emergency C-section. Otherwise, normally women can have a normal vaginal delivery.
Mm.
Simple line.
Okay, ma'am.
Okay.
Mm.
Then in the postpartum care after the delivery, the baby will be reviewed by a neonatologist to see for any sign of this thyroid
Hypo.
condition. He
Mm.
will support you in the breastfeeding, and
Mm.
before getting discharged, the contraception will be discussed, and you have to be refer your thyroid specialist doctor
Mm.
for your routine review. Okay.
Mm.
So at the delivery, you can also say that the routine thing that if there's any heavy bleeding, so we can offer you certain medications to arrest the bleeding,
Mm.
which we called as active
Yes, ma'am.
management of digestive labor. So all these things can be done, but this is not very important. The important thing is folic acid, all the thing. The
Okay.
important static one should not be missed. Then provide
Mm.
support and information leaflet. Okay, Manikam.
Thank you, ma'am. Thank you for the
Yeah, you
opportunity, ma'am.
performed good. Your starting was very good. You aware about the situation and
Mm.
how to handle the situation. But the thing is that your applied knowledge, you need to be make a very crisp sentences and very
Yes,
concise
ma'am. Mm.
sentences to cover in that 10 minutes, because we don't have
Ah.
any more than 10 minutes.
Okay, ma'am. I'll modify myself, ma'am. Thank you so much, ma'am.
Yeah.
Thank you for
Okay.
your good feedback. Excellent feedback, ma'am.
Okay. So, any question from anyone? So, so how you are getting from these session? Do you feel that these are helpful for your preparation or just
Ma'am,
wasting your time?
really, ma'am, very helpful, ma'am.
Okay, thank you so much. So our aim is to boost up you for your upcoming exam, and if there's any shortcomings, so we try to overcome with these sessions. Okay, so thank you so much for joining our session, and now we are going to end up and keep tuning up our Telegram group to see where when we have our next session, and the recording of this session will be uploaded shortly on our YouTube channel. Okay. So thank you from